Dr. Michael McCarthy, President of the Irish Society of Medical Oncology and a consultant medical oncologist at the University Hospital Galway, said, "Working in the west of Ireland, I see the human cost of the postcode lottery in Irish cancer care every day. Once chemotherapy is prescribed, the National Cancer Strategy states that it should start within 15 working days. The reality in Galway is that patients are now typically waiting 7 to 8 weeks for their first session. With every week that passes, the risk increases that the cancer will grow, or worse, that will spread to other parts of their body." Dr. McCarthy went on to describe the conditions of the facilities in Galway. In 2016, the day ward in Galway Hospital had 13,000 visits. By 2024, that had increased to 25,000. Our doctors, nurses, hospital pharmacists and others have done everything they can to minimise waiting times. However, we simply don't have enough staff, space or equipment to cope, and patients are paying the price. The report went on to note that at Galway University Hospital there is no PET scanner, meaning scans are being conducted privately at a higher cost. The hospital also needs a new CT scanner and facility. One CT scanner is 17 years old and keeps breaking down. Visit volumes have increased as patients require more intense treatment over longer durations. Tánaiste, we spoke previously about the work of the Capital Programme Oversight Team at the University Hospital in Galway and the need for progression of the infrastructural master plan that they have developed. Galway University Hospital is the only Model 4 hospital in the HSE North West area, West North West. It serves a population of over 850,000 people, and that patient population, Tánaiste, increases to 1.1 million for cancer services. That also includes Counties Clare and parts of the Midlands. The outdated, Shields themselves said during the development of the master plan that the outdated and suboptimal facilities in the hospital make the provision of adequate care more challenging. Recently, the Minister for Health launched the master plan for the new hospital in Galway. Among what is proposed in the master plan are additional beds, a new accident and emergency unit, a new maternity and paediatrics facility, new laboratories and a new cancer centre. The preliminary business case, I understand, for the new hospital, the new master plan, will be delivered to the Department of Health by the end of July. And interestingly, Tánaiste, in the Irish Cancer Society's pre-budget submission, they call on the government to address the deficits in cancer care by prioritising cancer infrastructure in the new National Development Plan. I just noted, Tánaiste, in response to an earlier response, you mentioned the social infrastructure that will be included in the new National Development Plan. Tánaiste, I'm looking for a commitment that the completion of the master plan for the hospital in Galway will be included in the National Development Plan, and that will include specifically for all aspects of the progression of the master plan, including the new cancer facility. And I suppose the one line from your response that really gives me some hope is your comment that the master plan development for the regional hospital in Galway will be a game changer, because it certainly will. Part of the preliminary works to enable that have started. Some of the outpatient services have moved to Merlin Park, and there are other plans to move more services to Merlin Park to ensure that we have a top-class facility for acute requirements, and that also we have outpatients and elective in Merlin Park. I do have to say, though, Tánaiste, I would really ask that the government would look at the commitment in that social infrastructure aspect of the National Development Plan to make sure that this master plan comes to full development and fruition. My understanding is that the preliminary business case highlights that the annual financial contribution required will be 1% of the annual health budget over a 10-year period.